I'm about to say something that may stop you in your tracks, something that may challenge everything you've been told about high blood pressure for years, maybe even decades. My name is Dr. Sharon Malone, and I've spent over 20 years inside operating rooms, clinics, and intensive care units, working with hearts, arteries, and blood vessels every single day. I've stood over patients whose lives depended on the condition of their arteries. I've opened chests. I've held diseased vessels in my hands. I've seen with my own eyes what high blood pressure really does to the human body. And I need you to hear this clearly. Almost everything you've been told about reversing high blood pressure is wrong. Most people are taught that hypertension is a simple plumbing problem. Too much fluid in the pipes, too much salt, too much water. So the solution seems logical, doesn't it? Cut the salt, take a water pill, flush out the excess fluid, the pressure drops. The numbers on the monitor look better, case closed, except it's not closed, not even close. That explanation comes from an outdated medical model developed decades ago, back when we didn't understand vascular biology the way we Ingalls now. That model is incomplete. And worse, it's keeping millions of people sick while giving them a dangerous false sense of security. The truth is this: high blood pressure is not about how full your arteries are. It's about how damaged they've become. Your arteries are not lifeless pipes. They are living, breathing tissues. And in people with hypertension, those tissues are injured, inflamed, stiff, and structurally altered at a microscopic level that no pill can repair. When I perform bypass surgery, this difference is unmistakable. A healthy artery is elastic. When I cut it, it springs back like a rubber band. It's alive. But a hypertensive artery doesn't behave that way. It crunches under the scalpel. It feels rigid, brittle, almost chalky. Sometimes the walls are so calcified I struggle to pass a needle through them. That stiffness, that loss of elasticity, that is hypertension. And here's what no one tells you. Blood pressure medications don't fix that rigidity. They don't heal the vessel wall. They don't restore elasticity. What they Ingalls is manipulate numbers. They adjust fluid balance. They relax muscle tone temporarily. They make the reading on your cuff look better. But the underlying damage continues quietly, invisibly, year after year. It's like lowering the volume on a fire alarm while the house is still burning. True reversal of hypertension doesn't mean chasing numbers. It means repairing arteries at the cellular level. It means restoring structure, function, and flexibility where damage has occurred. And by the end of this conversation, you're going to understand exactly how that happens. You're going to learn the 3 hidden mechanisms that actually cause high blood pressure, mechanisms most doctors were never taught to look for. And you'll learn the 4-step approach that addresses those mechanisms directly, not by managing symptoms, but by repairing damage. This isn't theory. This isn't hope. This is cellular biology. This is what I've watched happen in real patients who were told they'd be on medication for the rest of their lives, and who aren't anymore. So stay with me, because what you're about to learn could change the course of your health. Let's start with what hypertension actually is, at the level I see it when I'm operating. Your arteries are complex, living structures made of 3 layers. The innermost layer is called the endothelium. It's only 1 cell thick, thinner than tissue paper, yet it lines every blood vessel in your body. And it's not passive. It's not just a lining. It's an active organ that controls blood flow, prevents clotting, regulates inflammation, and produces chemicals that keep your vessels relaxed and healthy. When the endothelium is healthy, blood pressure is normal. When it's damaged, hypertension develops. But there's something even deeper, something most physicians never talk about. Covering the endothelium is a microscopic protective coating called the glycocalyx. I often describe it to patients as a non-stick Teflon layer lining the inside of your arteries. It's made of sugar molecules and proteins, only a few micrometers thick, invisible to the naked eye, but absolutely critical. This coating allows blood to glide smoothly. It prevents inflammatory cells from sticking to the vessel wall, and most importantly, it senses blood flow and signals the release of nitric oxide, the molecule that keeps vessels relaxed and open. When the glycocalyx is intact, arteries stay flexible. Blood pressure remains stable. But when it's damaged, everything unravels. And what damages it? High blood sugar, chronic inflammation, Smoking, oxidative stress. These factors strip away the glycocalyx layer by layer, like acid eating through protective coating. Once it's gone, the vessel wall is exposed. Inflammatory cells stick, cholesterol penetrates, plaque forms, nitric oxide production drops, vessels constrict. Blood pressure rises. This is the first mechanism of hypertension, glycocalyx destruction. And here's the uncomfortable truth. No blood pressure medication repairs the glycocalyx. Not ACE inhibitors, not calcium channel blockers, not diuretics. They control pressure while the damage underneath continues. That's why people with controlled blood pressure still suffer strokes and heart attacks. The symptom was treated, the disease was not. Let me tell you about David. He was 67. He'd been on 3 blood pressure medications for 8 years. His numbers looked perfect. His doctor was satisfied. Then one morning, he had a heart attack. When I opened his chest, his coronary arteries were rigid, calcified, unforgiving. Sewing a bypass graft felt like stitching into concrete. I remember saying to my assistant, his blood pressure was controlled, but his arteries were not. David survived, but his medications had given everyone a false sense of safety while the disease progressed silently. That brings us to the second mechanism, arterial stiffness. This is the most overlooked factor in hypertension, and in my opinion, one of the most dangerous. Doctors focus on the numbers, but they ignore the quality of the vessel itself. And vessel quality matters more than the reading on your cuff. Blood pressure is measured as systolic over diastolic. The difference between them is called pulse pressure. That number tells me how stiff your arteries are. A normal pulse pressure is about 40 to 50, but as arteries stiffen, systolic pressure rises and diastolic pressure falls. You might see readings like 160 over 70. That wide gap is a red flag. It tells me the aorta has lost its elasticity. It's no longer absorbing pressure. Every heartbeat slams force directly into the vessel wall. This pattern predicts stroke and heart attack better than blood pressure alone. There's a test called pulse wave velocity that directly measures arterial stiffness. It's quick, non-invasive, and incredibly informative, but it's rarely ordered because there's no pill that fixes stiffness, and medicine tends to measure only what it knows how to treat with medication. Arterial stiffness happens because the middle layer of the artery, the tunica media, becomes calcified. Calcium deposits form. Elastic fibers break down. Muscle cells begin behaving like bone cells. This process, called vascular calcification, turns arteries into rigid pipes, and no standard blood pressure medication reverses it. But here's the truth most people don't know. Arterial calcification is reversible. Not with drugs, but with specific nutritional signals that tell calcium where it belongs. The key player is a protein called matrix GLA protein, activated by vitamin K2. Without K2, calcium drifts into arteries. With K2, it's redirected into bone. Combine that with vitamin D and magnesium, and you create the conditions for decalcification and restored flexibility. I've seen this work. Margaret was 73 on 4 medications with severe aortic calcification. Over time, with the right protocol, her calcium score went down. Her blood pressure normalized. Her medications were reduced. Her arteries softened. That's not theory. That's physiology responding to the right signals. The third mechanism is what I call the insulin kidney lock, and it explains why salt restriction fails for so many people. Insulin tells your kidneys to retain sodium. When insulin levels are chronically high, your kidneys are locked into retention mode. You can eliminate salt entirely and your blood pressure won't budge because the problem isn't salt. It's insulin. This is why people with insulin resistance almost always develop hypertension. And here's the danger. You can have high insulin with normal blood sugar for years. Most doctors never test insulin, so the problem goes unnoticed while blood pressure rises. The solution is lowering insulin through time-restricted eating, resistance training, and improving insulin sensitivity. When insulin drops, kidneys unlock, sodium is excreted, blood volume normalizes, blood pressure falls naturally. I've watched this transformation in patients like Robert, who eliminated all blood pressure medications by fixing insulin resistance, not by forcing numbers down. Now, I want to be very clear about something. I am not telling you to stop your medication. That would be unsafe. Medications manage symptoms. These protocols repair causes. You need both, working together, under medical supervision. Hypertension is not a life sentence. It's not inevitable. It's not permanent. It's a condition rooted in reversible biological damage. When you repair the glycocalyx, decalcify arteries, restore nitric oxide, and normalize insulin, blood pressure doesn't need to be forced down. It returns to normal because your vessels heal. I've spent my career inside operating rooms, and my greatest hope is to keep you out of one. Your arteries matter. They are the lifelines of your body, and they can heal. Hypertension is not about the pipes being too full. It's about the pipes being damaged, and damaged vessels can be repaired. If you're willing to understand the mechanisms and ingles the work, reversal is possible. The choice is yours. I want to keep going, because there's something very important that happens after people hear everything I've just explained. They sit back and think, all right, Dr. Malone, I understand the science, but what does this actually mean for me tomorrow morning? And that's a fair question, because information alone doesn't change outcomes. Action does. And action only happens when you truly understand what's at stake. So let me slow this down and speak to you the way I speak to my own patients when they're sitting across from me, nervous, overwhelmed, and wondering if it's already too late. First, I want you to understand this clearly. Your arteries are not dead tissue. Even in your 60s, 70s, or 80s, they are living, responsive structures. They are constantly remodeling themselves based on the signals you give them every single day. Food is a signal, movement is a signal, stress is a signal, sleep is a signal. Even how you breathe is a signal. Your body is always listening, and the question is not whether change is possible, but what kind of change you're signaling. For decades, standard care has focused on overpowering the body with medication instead of retraining it. And while medication has its place, it does not teach your arteries how to heal. Healing requires the right biological environment. When you create that environment, your body does what it has always been designed to ingles repair, restore, and rebalance. Let's talk more deeply about why this matters beyond blood pressure numbers, because hypertension is rarely the real disease. It's the warning light on the dashboard. What's underneath is vascular aging. And vascular aging is what leads to stroke, heart attack, kidney failure, dementia, erectile dysfunction, vision loss, and heart failure. All of these conditions share the same root problem: damaged blood vessels. When your arteries stiffen, your heart has to work harder with every beat. Over time, the heart muscle thickens. It becomes less efficient. That's how heart failure develops, even in people who never had a heart attack. When small vessels in the brain stiffen and narrow, blood flow becomes uneven. That's how vascular dementia begins. When kidney vessels are damaged, filtration declines. Blood pressure rises further. It becomes a vicious cycle. This is why I never treat blood pressure as an isolated issue. I treat it as a whole-body vascular condition. Now, let's go deeper into something that surprises almost everyone I talk to: why lowering blood pressure alone can sometimes make people feel worse. Have you ever noticed that some people start medication and suddenly feel dizzy, fatigued, foggy, or weak? That's not because their blood pressure was too high before. It's because their arteries were so stiff that their organs had adapted to higher pressure just to get enough blood flow. When you lower the pressure without fixing the stiffness, perfusion drops. The brain gets less blood. The kidneys get less blood. The person feels unwell. This is another reason why structural repair matters so much. When arteries regain flexibility, blood can flow smoothly at normal pressures. The body doesn't have to compensate anymore. Energy improves. Mental clarity improves. Endurance improves. Patients tell me they feel younger, not because we gave them a stimulant, but because their circulation finally works the way it's supposed to. This is why I encourage people to stop asking, "What should I eliminate?" and start asking, "What stabilizes me?" Stability heals vessels. Protein stabilizes blood sugar. Fiber slows glucose absorption. Healthy fats reduce inflammation. You don't need perfection, you need patterns. And let's talk about salt, because it deserves clarity. Salt is not evil. Sodium is essential for nerve function, muscle contraction, and blood volume. The issue is not salt in isolation. The issue is salt in the context of insulin resistance and damaged kidneys. When insulin is high, sodium retention becomes pathological. When insulin is normalized, salt tolerance often improves dramatically. I've seen patients who were salt sensitive for years suddenly tolerate salt again once insulin levels came down. That's not magic, that's physiology. Now, I want to address something emotional that doesn't get enough attention: fear of exertion. Many people with hypertension become afraid to move their bodies. They're told to take it easy, to avoid strain, to be careful. And caution is appropriate, but fear is not. Fear activates the sympathetic nervous system. It raises blood pressure. It constricts vessels. Movement, done correctly, teaches the nervous system that the body is capable and safe. That confidence translates directly into vascular tone. This is why walking outdoors, especially in daylight, is so powerful. It combines movement, nitric oxide stimulation, circadian rhythm alignment, and nervous system regulation all at once. And please hear this: you Ingalls not need to be athletic to heal your arteries. You need to be consistent. 5 minutes done daily beats 30 minutes done once a week. Gentle done often beats intense done rarely. Now let's talk about breathing again, because it's one of the most underestimated tools in vascular health. When you breathe through your nose slowly and rhythmically, you stimulate the vagus nerve. The vagus nerve shifts your body out of fight or flight and into rest and repair. Heart rate slows, blood pressure drops, nitric oxide increases. This is not psychological. This is anatomical. I've had patients lower their blood pressure by 5 to 10 points simply by practicing slow nasal breathing for 5 minutes twice a day. No pills, no equipment, just physiology responding to the right signal. And this brings us to something very important. Hypertension is as much a nervous system condition as it is a vascular condition. Chronically elevated sympathetic tone keeps vessels constricted, insulin elevated, and inflammation active. Repair requires parasympathetic dominance. Calm is not a luxury. Calm is treatment. Now I want to speak directly to anyone who has been labeled non-compliant in the past. Maybe you were told you didn't follow instructions well enough. Maybe you were made to feel like your condition was your fault. Let me say this clearly: lack of understanding is not non-compliance. When people understand why something matters, they're far more likely to Ingalls it. And now you understand. You know that every supportive action you take sends a signal. You know that arteries respond to those signals. You know that change doesn't require perfection. That knowledge changes how you show up for your health. I also want to address age again, because age gets blamed for so much unnecessarily. Aging does not automatically equal stiff arteries. Aging does not automatically equal hypertension. Aging simply means your margin for error is smaller. Recovery takes longer. Signals need to be clearer. That's all. Think of it this way: younger bodies can tolerate chaos. Older bodies need rhythm. And rhythm is something you can create. Morning light, regular meals, consistent movement, predictable sleep. These are not boring habits. They are biological anchors. As we continue, I want you to hold on to this idea. You are not trying to fix yourself. You are creating conditions where repair becomes inevitable. When those conditions exist long enough, blood pressure normalizes because it no longer needs to compensate. This is why I remain hopeful, even after decades in medicine, because I've seen what happens when people stop chasing numbers and start restoring systems. And in the next part, I'm going to talk about what progress actually looks like, because it's not always linear and it's not always reflected immediately in the numbers on a cuff. Understanding that will keep you from giving up too soon. So stay with me. Now, let's go deeper into something that surprises almost everyone I talk to: why lowering blood pressure alone can sometimes make people feel worse. Have you ever noticed that some people start medication and suddenly feel dizzy, fatigued, foggy, or weak? That's not because their blood pressure was too high before. It's because their arteries were so stiff that their organs had adapted to higher pressure just to get enough blood flow. When you lower the pressure without fixing the stiffness, perfusion drops. The brain gets less blood. The kidneys get less blood. the person feels unwell. This is another reason why structural repair matters so much. When arteries regain flexibility, blood can flow smoothly at normal pressures. The body doesn't have to compensate anymore. Energy improves, mental clarity improves, endurance improves. Patients tell me they feel younger, not because we gave them a stimulant, but because their circulation finally works the way it's supposed to.